Hi, my name is Cerrene Giordano. I'm a dermatologist and Mohs surgeon at Roswell Park Comprehensive Cancer Center. I went to medical school locally here at the University of Buffalo. To be honest, I didn't know I wanted to be a doctor my whole life. I thought I wanted to be a veterinarian. I went to Canisius College, or might now be Canisius University, but I studied marine biology and then sort of found my way actually through doing a little bit of research at Roswell Park to medicine, and it stuck. My career jump was pretty big, but it was just something that really spoke to me and really called to me. I think the one thing between veterinary medicine and human medicine is that you're a caregiver. You want to take care of people, whether it's animals or humans. And so for me, the transition was very easy. And once I got into the human side of research, it was just something that I knew I enjoyed doing. I found dermatology actually through Roswell Park. I ended up doing a summer internship program between my first and second year of medical school. And serendipitously, I was fortunate enough to rotate through the dermatology department, and specifically with Dr. Natalie Zaytouni, who was the Mohs surgeon here at the time. And she was just so phenomenal and became such a mentor to me that I knew that I wanted to pursue my career in what she did. My entire career thus far, I've always been in academics. So even at the prior institutions that I've worked at, I've always valued research. I've always valued an individualistic approach to very patient-centered care. My family is here, I'm from here, I'm a local gal at heart, so making the decision to come back home was easy. And I'm just fortunate enough that we have such a dominating cancer center here that I'm grateful to be a part of. I believe that Roswell Park is one of the best and, as the name suggests, most comprehensive cancer centers in not only the area but in our nation, and we're so fortunate to have it here in our backyard. One of the things that I personally love about Roswell, and I have family members that have been dearly impacted in the most positive way with Roswell, but is that they link the most up-to-date research and the most up-to-date science, and they bring it to the bedside so that you are receiving not only an individualistic approach to your treatments and your care, but really top of the line and in the forefront of all of medicine. And I think that that part of it is very special. I also think that the teams here are extremely special. We have tumor boards, we have groups, all the specialties work very, very closely together in order to achieve the same goal, which is ultimately eradicating cancer. I love my job very much. I'm very fortunate to be in the position that I'm in, and now even more fortunate to be here at Roswell. The patients really make my job what it is. I'm exceptionally lucky to get to see different patients of all ages, of all backgrounds, every single day, and I get to be a part of the Roswell mission in providing patients not only treatments and oftentimes cures, but also that hope and that compassion. And so my patients inspire me just as much as I hopefully aim to inspire them. And I would say that that's what keeps me running each and every day.